Maybe not. Good morning, everyone, and happy Saturday. How's everyone doing this morning?
Hello.
Good morning.
Doing
Happy
good.
Saturday.
Morning.
Wow. Okay, well, we usually have fun during our preamble, but this morning was something special. We are getting started definitely late, so we're going to hop right along here. Appreciate everyone's patience. I have to say that we were joking beforehand that we were going to do a commercial during today's episode of Voices of HealthPointe, and apparently we need to pay my Zoom bill or something because Zoom just conked out on me as soon as we were getting going. But hey guys, I will get my tech figured out throughout the program. We're going to get rolling as we kind of normally do. For those that are new to Voices of HealthPointe, this is a time where those of us that have an interest in HealthPointe, we gather every Saturday morning for ideally from 8 a.m. to 9 a.m. Eastern Standard Time, although sometimes technology has a different plan in store. So we're getting started a little bit late here this morning. But we typically have some docket items, and I'm going to go through those. And also for those that either aren't able to join us live or just choose not to, these episodes do get uploaded onto the YouTube channel called Voices of HealthPointe. So with that, let me kind of go through the docket items that we have this morning. We have myself that is going to do a docket item titled Motivational Interviewing, Turning the Key to Change.
Park behind me, though.
And we've got some background noise, folks. And again, I'm not on my normal device. So you're going to have to help me out with muting yourself on some background noise. Let me actually do that here on a few people here, because I know it is hard to realize that you're not muted. Okay. So we've got myself on the motivational interviewing. We've got Carol that's going to do a quick book promotion. And then we have David Munoz that is on planned recovery. For those that aren't familiar with David Munoz's story, you'll hear about it, and it's exciting to hear from him. And then we've got David Dassow on a 90-second movement commercial. David, I'm calling you out for throwing this all into a tizzy with your comment on a commercial. Okay, guys, with that, I'm going to get moving through mine. My camera's not on. We'll fix that later. And so let's get cooking here. So first, I want to say that the content shared here is for informational and educational purposes only. It's not intended as medical advice, diagnosis, or treatment. Always consult your healthcare provider before making any changes to your health routine. Our discussion draw on wellness concepts similar to those found in the HealthPointe methodology, which we hold in high regard. The ideas presented are independently developed and do not represent or speak on behalf of the HealthPointe brand. And let me just see if I can hit a mute all here.
That's right.
Okay, we've got everyone muted, and so just bear in mind that, when I wrap up, we invite, commentary and discussion and stuff like that, but you will need to unmute yourself because I just did a mute all. Motivational interviewing, turning the key to change. Motivational interviewing is one of those concepts that once you truly understand it, begins to change almost every conversation you have. At its core, motivational interviewing is a way of communicating that helps people hear their own reasons for change. It's not about convincing, correcting, or prescribing. It's about guiding, drawing out, creating the conditions where someone can arrive at their own conclusion rather than being pushed towards yours. And when that shift happens, something meaningful changes. For many of us, there was a similar moment when we read the book Personality Plus. Many of us here in Voices of HealthPointe have read that book and are familiar with it. Before reading it, interactions with people could feel frustrating or confusing. We may have found ourselves trying to muscle conversations, wondering why others did not respond the way we expected. After reading it, the same situation began to make more sense. We felt more empathetic, more aware, more effective. It did not necessarily change the people around us. It changed how we understood them. Motivational interviewing has a similar effect. And in many ways, it goes a step further because it not only changes how you interpret people, but how you communicate with them in real time. What is interesting for me personally is that motivational interviewing has been at the core of nearly every certification I have pursued. It was foundational in my board certification as a health and wellness coach. In many ways, it is the base layer upon which everything else was built. And yet, like many things we learn, it becomes so integrated into how we operate that we stop noticing it. Nancy Dornan, many of you are familiar with, Jim, the late Jim, and then Nancy Dornan, the founders behind Network 21, she often shares a simple idea that many of us have heard. Teach deliberately what you do instinctively. When something becomes second nature, we can forget that there was a time when it was new, a time when it felt distinct, a time when it changed how we saw the world. That perspective came back into focus for me this week. I had a conversation with a prospective coach who spoke about motivational interviewing with a level of energy that was hard to miss. She described how impactful it had been during her time as a nurse, not just as a tool, but as a shift in how she approached people altogether. She went on to study it further to become an instructional in it, and it is one of the reasons she is now exploring health and wellness coaching within the HealthPointe framework. There's a good chance, in fact, she's maybe on Zoom today. I have to laugh about that because probably a lot of people aren't on Zoom after this morning's technical faux pas. But listening to her brought me back to that earlier stage of learning, that moment when you first realized that what you thought was a people problem might actually be a communication problem. Because most of us have experienced the same cycle. We see someone we care about. We see something that could help them, and we move towards them with good intentions. We explain, we suggest, we encourage, sometimes we push. And very often we are met with resistance. That resistance can feel confusing. It can feel like the other person is not motivated or not ready. But motivational interviewing offers a different explanation. It suggests that people are not lacking motivation, they are experiencing ambivalence. Part of them wants to change, part of them wants to stay the same. And when those two forces are present, pressure tends to strengthen the side that resists. This is especially noticeable in close relationships, in families, between spouses, between parents and children, or among close friends. The desire to help is strong. And because it is strong, the communication often becomes more direct, more corrective, more insistent. I just want what's best for you, we say. And yet, that approach can create tension rather than progress. Motivational interviewing offers a different path. Instead of trying to push the car, it focuses on turning the key. Rather than telling someone what they should do, it invites them to explore what they want to do. Instead of correcting, it reflects. Instead of prescribing, it draws out. At its core, it's built on a few simple shifts: asking rather than telling, reflecting rather than correcting, evoking rather than prescribing, supporting autonomy rather than controlling behavior. These shifts may seem small, but they change the entire experience of a conversation. This approach was originally developed by William R. Miller and Stephen Rolnick. And by the way, guys, I'll provide some resources in our email that goes out. But it was originally developed by William R. Miller and Stephen Rolnick, and has since become widely used across healthcare, coaching, and behavior change fields. One helpful way to understand it is through its 4 core tasks. Engaging comes first. This is about building trust and connection. Without it, nothing else works. People need to feel heard and respected before they are willing to explore change. Focusing follows next. This is where direction is established collaboratively, not imposed, but agreed upon. It answers the question of what actually matters to the person in front of you. Evoking is the heart of the process. This is where you draw out the person's own reasons for change, their own language, their own motivations, because what people hear themselves say carries more weight than anything said to them. Planning comes last. Only after motivation is present does it make sense to talk about next steps. And when those steps are self-directed, they are far more likely to be followed. This framework is not just for coaches. It applies to clients navigating their own change, to parents guiding their children, to spouses communicating in relationships, to anyone who interacts with another human being. In fact, the closer the relationship, the more valuable it becomes because the instinct to fix is strongest where we care the most. And the stronger the fixing, the stronger the resistance. From a biological standpoint, this makes sense. Humans are wired for autonomy. When that autonomy feels threatened, even slightly, the brain moves to defend it. When that autonomy is supported, openness increases. Motivational interviewing works with that wiring rather than against it. This aligns closely with what we do in HealthPointe. The goal is not to force change. The goal is to create conditions where change becomes more likely. Our daily conversations, check-ins, and coaching moments are opportunities to guide awareness and support ownership. Because ownership is what sustains change. When someone says, quote, "I've decided," rather than "I was told," something important has shifted. Conversations become more productive. People feel heard rather than managed. Progress becomes internally driven rather than externally imposed. So a useful question to consider is this: where in your life are you trying to push when you might instead guide? And what might change if the goal of the conversation was not to convince, but to understand? Like we learned in the book Personality Plus, once you see it, you begin to recognize it everywhere. Okay, guys, that's my docket item on motivational interviewing. And again, I will put together in the email summary that goes out with the episode and its links. I'll put some resources in there, a couple of resources. One would be on a brief, I think it's like a 7 or an 8-minute YouTube on motivational interviewing. I mean, there's tons of content out there, but also that book that I referenced on the kind of call them the founding fathers of motivational interviewing. And I'll provide a link to that book. So provided I didn't boot myself off of this Zoom somehow, if anybody has any comments, questions, again, remember to unmute yourself and go ahead and chat around.
Eric,
Yes.
I do have a question. Do you know what number this episode is? Because obviously walking, we can't take notes and there's a lot of great notes to be taken. Would you know the number?
I do, and also it will be in the email that goes out. Do you get that email, Pam?
I do.
Okay.
So I can get it from there.
Yeah,
Thanks.
yeah. You bet. Absolutely. And great question. Yeah, I think we're up around 130 or 140, I think in the 130s on these Voices of Health Point episodes, which is amazing to me. But when the email that goes out, and then Carol, I know that you send that out as well, it always has that episode number in there. So yeah, that'll be in there. Thanks,
I have a
Pam.
book that coincides with a lot of this. Is Dale Carnegie's How to Win Friends and Influence People. All of the same topics are included in that.
Oh yeah. Yeah, gosh. And Dave, of course, you were busy recovering, but I think was it last episode, guys, or 2 episodes ago that Debbie Llewellyn, I think you did a segment on that book. I think it was, and maybe you remember, Debbie, but but point taken, David. That is these are foundational insights into human behavior and human interaction. And so this one on motivational interviewing, it's no surprise that it shows itself in other principles and books and so forth.
No,
Okay,
Eric, I think from From a coaching standpoint, I'll just kind of butt in here real quick. From a coaching standpoint, I think it's probably one of the most valuable articles that you have read, well, compilations, because that's what we are about on coaching. And that first segment of coaching, that first 6 weeks, is a lot of instructional because it's all brand new. But when we get to a certain point, there has to be an ownership transfer. And I think that your article just really, really brings out that ultimately a person needs to take ownership because then they will be making the choices. And that's where your motivational interview will help along. I just wanted to real quickly, because I know we're short on time. I'm almost finished with a book by Mel Robbins, and it's called Let Them. Some of you might be familiar with the book. I was not. And I kind of stumbled upon it. And I think it just ties so much into this, where ultimately a person is going to do what a person is going to do. And with what Eric, you talked about with the motivational interview, helps that process along so that they will do the things you want them to do, but that they really need to do, but they realize they need to do. And in there, Mel talks about let them. Sometimes we have to create all the groundwork and the relationships, which are extremely important, number one. And then we have to let them be where they're at. So we always say, meet them where they're at and take them where you want them to go. That's an age-old business saying, and it's so true in this HealthPointe coaching. So you have to meet them where they're at. And through motivational coaching, motivational interviewing, you can help them realize that earlier in a more strategic way. But then ML says this thing is let them be where they're at, but then let you. So that's the hard part because you have to let go and let them. You can instruct them or, all of those types of things bring out different points, but you have to let me. I have to let go to where they're at this point in time, or we're not going to go anywhere. All we're going to be doing is butting heads. So that is a great book for coaches. It's called Let Them by Mel Robbins. And I highly encourage every coach to read it because I think it helps so much in the coaching aspect of things. So back to you, Eric.
Boy, Carol, in the preamble, when Carol mentioned that she was going to be promoting a book, we had no idea of what, in fact, we even I commented that, hey, we'll just leave it. You didn't share what the book title was. And I said, hey, this will be great. I'll just queue it up as a docket item. And here we are again, basically talking about the same concept. I haven't read that book. I'm going to make note of it. In fact, I can include it also in the email that goes out. I'll link to it to make it easy for people. But just the title alone, Let Them, seems very aligned with the whole foundational premise of motivational interviewing. This is about autonomy and self-efficacy and agency, and a title like Let Them. And I do know of Mel Robbins. She's very, very notable, amazing individual. And so this sounds like a great book. And so timely. Once again, here we are on the same cloud. Didn't even know each other's topics, and yet we're talking
No.
about the same thing. This is great.
I have a thing that I used to use when I used to coach people. And I used to, because you have that, like Carol said, and I agree with 100%. At the beginning, you have to lead, and then you're transitioning into letting them develop or coming up, the Dale Carnegie, How to Win Friends and Influence People, asking questions with the purpose to get them to come up with the concept on themselves. But in the beginning stage, what I found out, instead of telling people, what I used to use is what I call feel, felt, found. So, I used to say, because you're trying to connect with them at the same time without telling them. So I used to say, I understand how you feel. I or my team felt the same way, or, something happened in the past that, you use something that you related to and that gave you that purpose or mindset. And so I understand how you feel. I felt the same way, or this happened, felt the same way. but what we found out is this, So you're explaining it at the same time you're encouraging them to understand that you understand how they feel and they're not in the wrong because other people have done it too.
Yes. Yes, that's a great point, David. The feel, felt, found framework is such a great tool. And it's also, as you're listening to someone, isn't it nice to kind of have something like feel, felt, found in your mental toolbox to just kind of guide that discussion? I don't know if you feel that same way, David. When you're hearing somebody and you're like you want to continue the conversation in a manner that provides value to them, and to have this framework, this easy thing to remember, like feel, felt, found, it just really can be helpful.
Yeah, it's like because you're not trying to tell them, you're just trying to explain to them what's happened in the past that maybe changes their mind, or have them come up with it and said, I never thought about that. So they're coming up with that.
Yeah. Yeah, that's such a great point. Well, David, since we've got you on, how about if we move to your docket item? And that is, the title of your docket item that you mentioned in the preamble was, planned recovery. But why don't you take it away on your docket item?
Okay, will do. I just got out of surgery a little over 2 weeks ago now. I can so on the fourth I had my surgery. But actually, what ended up happening was I went in and, I told my wife a year ago I needed to get healthy because the doctor told me if I get healthy, it'll be a lot easier when I do have the surgery. So she ended up getting me healthy. I know we discussed in the past, but I know that we're short on time, but I wanted to explain to you guys what ended up happening because of the planned recovery. So we needed to lose weight. I needed to get off meds. I needed to lose fat. I needed to do all that, and HealthPointe was the answer. So, and my wife is a great coach, and she, helped me out through the whole process. All the supplements and vitamins kept me going. All the walk and talks and everything kept me motivated and all the so it was an overall excellent program. And when I went in to see the doctor, they ended up moving up my surgery and moved me to the location because I wasn't as I wasn't such a high risk anymore. So they ended up moving me somewhere where they could do it quicker. And when I went in, they ended up doing extensive surgery. They had to open me up again, and then they did everything they needed to do. And then when I got out of surgery, I was groggy as heck. Kathy can probably explain more of what they said. But I do remember something that one of the surgical RNs or nurses had ended up saying. She goes, "It was one of them. It is the most uneventful surgery we've ever had." So it was like, oh wow, I never heard that before. So I said, great. I said so, and then a little while after that, there was a wedding, so we weren't sure at the beginning whether I was going to be able to go to it. Not only did I go to the wedding, I wasn't on my dancing self, but I ended up dancing with my wife. So we were out there moving and shaking. She was doing more of the shaking than I was, but I was definitely moving around. And everybody, one of my, Dustin, the person that got married, comes up to me and says, "I don't know who your surgeon is, but I want his name and number." And I'm like, it wasn't a surgeon that did it. It was because we planned it out and we had a great team, that did it. So I was, happy to say that it was, more my wife than it was, the surgeon that helped me get here. So it's one of the. So right now I still can't do a lot of things just because of the extent of the surgery, but everyone's surprised about how I am. In fact, everybody was coming up to me and couldn't believe. They go, "How skinny you look!" And I said, "I'm not worried about that. I'm healthy." So I said that's the main thing. I told my wife to get me healthy. Yeah, I mean you get skinny when you're getting healthy, but isn't that great too? But the only bad part was somebody comes up to me and smacks me on the stomach. Can't believe how skinny you are. I'm like, oh, no, thank you. Don't do that again.
Oh,
Because they thought I
geez.
was so healthy. They didn't realize you just got out of surgery. So
They didn't get the memo. My
they didn't
God.
get.
And remind us again. I know the story of you and Kathy. I remember Kathy's numbers, or it was 58 pounds loss, and yours. You've had different segments. Before surgery and then after surgery and so forth. But kind of in this latest wave, roughly where you at on weight loss?
I had lost 60 pounds. I got off 8 meds. I fit in the clothes I couldn't fit into for the past 10 years. Before the surgery, I was able to climb 42 flights of stairs, not all at the same time. Don't get me wrong, I'm not that crazy. But 42 flights of stairs. So, going into the surgery, I was very healthy. And then coming out, I'm getting healthier every day.
And the
Wow.
wedding was 19 days after his surgery, by the way. And he also, it was a downtown wedding, so we had to park at a parking structure, and then we had to walk about a half a block to get into where the hall was, and then walk into the hall, and then the ceremony was on the 3rd floor, the bathrooms were on the 2nd floor, and so he did a lot of walking that night too, and I'm so incredibly proud of him. So he's my star, that's for sure.
Man, what a story, what a journey, what a dynamic dual team on this, and and what an update. So great to hear the commentary from. I mean, what better commentary can you get from? That's great. So great stuff. And if if I'm not muted, I don't think I am. Again, thank Dassow, who I'm this morning, but David Dassow, if Doc, an item on your 90-second movement commercial.
Great. So before I get started, just congratulations to Dave. So we know the long journey you've been on, and to have that great victory story. We just cheer you on. We're just so proud of you and Kathy, your coach, for getting you over the finish line and getting you so healthy. So grateful for that. And so another commentary is just what you shared about motivational interviewing. All I could think of was many Hankisms, because Hank always talks to me about David, stop selling, and what he calls peel the onion, ask questions. And one of the long time ago, I went to a business meeting, and it was Vicky Brewer, who is an Emerald in Indiana, was the keynote speaker. I think it's the only time she's ever been a keynote speaker. And she said, when you finally get the person on the nail or they're revealing their pain, she said, keep them on the nail. So that's my comments on what's happened ahead of me. So I'm David of David and Chris Dasso. I've lost 30 plus pounds, and I'm currently on no medication. Chris has lost 100 pounds, and she went from 4 to 1 she's still on 1 medication. And so my commercial break is that Chris and I went out for dinner this week at a Polish restaurant. And so there's a lot of older people there. And I'm sitting there, and I glance over at another table, and it's an older lady, and she gives me a smile back. We just kind of eye contact, and I can finish my meal, or we're eating. She finishes her meal, and she starts to walk past us, and she has a cane, but she's moving pretty good with her cane. And as she walks by our table, I just look up at her and I say, keep going. I'm so proud of you. You're doing great. She took about 2 more steps, stopped, turned and looked at me. And when she looked at me, it was like I was listening to God. Because she looked me dead in the eyes and she said, I'm 96. I exercise every morning. And then she walked out. It was like, is that not the people who know me? I'm not the morning person. I do get up and exercise, but I have to really push myself to do it. Well, she was extremely motivational. That, as you also said earlier, that one of our big motivations is freedom. And moving our body every day is one of the things that keeps us in the freedom zone. That's it. That's my commercial.
Wow. Thank you, David Dassow. And that is such a important message. It's interesting. And I think Emily is probably on here, my wife, Emily, and we have been recently watching some, YouTubes, her parents stay with us and so forth. And we were just watching some last night about, we'll just say it, older people. I don't think any of them were 96, but that's the message coming through and through on that movement, movement, movement every day. Wow. What a great 90-second commercial break on that, David, as you're continuing your movement, moving around there. Awesome. Thank you. Any other thoughts, comments? I think
I did
I'm
have
back
one more
up
thing.
with my original device here, but David Munoz, back at you. I think I heard
I
you.
forgot to mention one thing, through the whole thing, I mentioned that I wasn't able to exercise or lift more than 25 pounds originally. But I was on I didn't want to lose my muscle through this whole event. So I ended up taking muscle multiplier just to maintain my muscle. So that way I didn't come out of this weak, for the recovery. So I was ended up having my muscle multiplier, which, my plan is to later on to, go from 1 scoop to 3 scoops, to start building muscle and start getting my shape going again. So I ended up not losing any muscle, but losing the fat, through the whole process. So that's my spiel on the muscle multiplier. It definitely helped me with my recovery because I was able to maintain my muscle without losing it and then get in better condition. So I could take my wife out on the dance floor.
Nice. What a
One other
great
thing, if I can interject also, when he had his abdominal surgery 2 years ago and he ended up being in the hospital for like three weeks after that surgery, then he went to a rehab center for 2 weeks. Then he came home and had in-home rehab for like another 2 weeks. Absolutely no rehab this time. He had his surgery early Monday morning. We were back home by 2:30 Wednesday afternoon. He used the walker on Wednesday and Thursday to get himself out of bed. After that, no walker, no nothing. He's there. So again, he planned for it. So anybody that's planning the surgery, get on HealthPointe and get healthy beforehand. It'll make a heck of a difference.
Wow. That's great. And for those of us that have been along for the journey a bit, we know, yeah, how David and both of you. I mean, it's again the dynamic duo team approach there about how he planned, for this surgery and was able to move that surgery up. Wasn't it, accelerated? Wasn't it, they were able to, because they didn't have to kind of like go into like a high risk, heavy staffed environment. It was like, hey, you brought yourself into a lower risk category or something like that. Is that kind
That
of the
was like,
details?
it was like 6 months, I believe, right, honey? They moved me up.
Yes, originally it was 6 months. It was supposed to be January. Then we had wonderful insurance issues, but there wasn't any openings at the main hospital until June or July, back in November or December when they were scheduling the January date. But then we did get moved to March. So again, still 3 months before possibly we might have gotten in. So yeah.
Wow. Again, what an amazing message. What an amazing story. But what an amazing message, like you say, Kathy, for anyone that has a known surgery, a planned surgery, to be able to get to your healthiest state possible for your surgery and then your subsequent recovery. What a huge message. And we talk about the non-scale victories, and I think you guys were on, right, for the non-scale victories episode that Carol hosted.
Yeah, that was the night of his surgery, actually. So I remember I kind of talked on his behalf a little bit because he was way too groggy to talk. He was hoping to, but we had no idea he was going to be as groggy as he was. He didn't even remember me being there.
Oh, wow. That's great. That's fantastic. Well, again, thanks again, and thanks for jumping back on there, David, on the topic of the muscle multiplier. Again, for those that weren't part of the original reboot of this session today, Carol Zampa on the Monday evening is going to be doing a segment that she's asked Steve Beber, who is just such an expert on the topic of muscle, well, so many products, but not the least of which is the muscle multiplier. And he's going to be doing a special segment on that. I don't know if you want to comment on that any more, Carol. And also, as you do or don't on that, Carol, I'm going to, my other device, my original device says it's ready to go back up, and I kind of miss not being on camera and connecting with you guys here. So I'm going to say this. When I do this, it might all explode, and then our episode will be over. But that will be fine. We'll just wrap up our episode without any fanfare. We'll just go out with a clunk. But Carol, if you're going to come on while you're talking, I'm going to try to mute this other device and reboot my original one, and hopefully see you guys on camera. So take it away, Carol.
Well, Eric, thank you for your resiliency and your connectedness and everything. And yeah, we are going to end because we want to get into our walk and talk with worldwide walk and talk. So I made my muscle multiplier while I was listening to David. I came in a few minutes early. Then that's what I typically do after a power walk is get my muscle multiplier immediately because everything is warmed up and that's the time to take it. Yeah, I'm very excited about Monday night. You all know Steve Beber is an excellent presenter of different products. And two of the products that I've always felt have been really important, maybe not the initial package, but I would say maybe the following order is to suggest the Focus on Energy, as we all know, rhodiola, or as Sharon Webb calls it, the happy pill. And then the other one is the muscle multiplier, which Dave touched on. And so I've asked Steve, and poor Steve, he didn't even probably know about the second part. We're just going to throw the program at him and ask him to just give some benefits of multiplier and why it's important with HealthPointe. Maybe it doesn't have to go into all the detail of muscle multiplier, but why it's so helpful with a weight loss or wellness program. So I think, Steve, I'm going to just prepare our program for Monday night. If we can build in a little testimonial from Dave Munoz, a little quick one from his recent surgery experience and how he felt the muscle multiplier really helped, I think that would be a great wrap to that little second portion. So guys, invite your customers on because customers need to know add-on things. Maybe you don't want to throw so much at them at the very beginning, but they need to know add-on things that will really benefit them in the program. And so that would be a great time to do that because it'll be very customer driven. So Eric, are you on or are we going to move? Oh,
I am back on. I'm back on and miss you guys.
well, you're looking wonderful.
Oh, thank you. I just felt like totally disconnected. But again, appreciate everybody's patience as we did get started late. This will be a bit of an abbreviated episode, but not too much. But we will wrap up a little ahead of time here because there's two things ahead of us here on Saturday. And I, in the interim of changing devices here, I might have missed. So if I'm redundant on this, it never hurts to hear it twice. But we've got, for those that are participating in the global walk and talk at 9 a.m. Eastern Standard Time, Network 21 has a Zoom link out for that. And so we'll want to, there we go. Carol's got the flyer there on walk and talk. So probably everybody's got their emails. If they haven't, if they want to join in on that, just reach out to your coach and get the link on that. And then secondly, and you probably mentioned this as well, Carol, at 4 o'clock Eastern Standard Time is the 1 hour Network 21 produce. And guys, if you've never experienced a Network 21 production, well, I would normally say that they're more professional than the Saturday morning Voices of HealthPointe walk and talk. But this morning, they are definitely a step up from what we provide here, or what I provide here, in terms of the polish and the lack of clunkiness. So just know that we're kind of like the one end of the spectrum, where it's all clunky and real and kerflunkety, and then at 4 o'clock we'll see a nice polished studio setting, and they just do such a great job. And I mean, we've got Dr. Stu Men on there. We've got
really impressed. Dr. Stu Man he's the head of a sleep disorder clinic that he started in San Diego many years ago. He's going to talk about HealthPointe and how it helps your sleep, or any sleep disorders. I've got people coming on just because they got sleep disorders and they want to hear him. So really promote that, guys, with anybody you know. Everybody got all the customers, everybody of my customers anyway, and preferred customers of yours, all of them got an invite. So please make sure that you really stress Dr. Men. Sorry, Eric, because I did
no, that's
not do
great.
that. I didn't cover that.
That's all right. And then we've got Leslie as well. Drawing a blank on how to say their last name. Samara, I think it is.
Samara, yeah.
Yeah. So anyhow, it's going to be phenomenal, guys. If you don't have that link, if you're able and want to join, get the link from your coach. It's at 4 o'clock. I think it's 1 hour, 4 to 5 Eastern Standard Time. So we will wrap with that, so that we all have a couple of minutes to launch into that. And so, guys, we've done it again. This is our last episode for the month of March. We'll see everyone in April for our next episode. Same time on Saturday, same place. Until then, bye-bye.
Bye.
Thanks, Eric.
Bye. Thanks, Eric.
Thank you.
Amazing.
Bye.